Okay, let's start the assessment. First, we're going to ask the patient to remove his shirt. As you can see, he has no shirt now. Next, we are going to assess the jugular vein and the carotid artery. And that's here and here. We're going to look for a pulse. Pulse nerve, carotid artery, jugular vein, gas, carotid artery, vein or pulse, jugular vein of the pulse. Okay. Next is shine a pen. Next is to shine a pen light and look for any pulsations and shadows. So, ito lang. One side lang taron ha. So far, there are no veins protruding or shadows, as I can see. If jugular distension is noted, assess for the jugular venous pressure by locating the highest point of distension. That's usually right here. Look for. But as in this case, there are no jugular vein distension. Note that the jugular vein should not be distended or protruded, so it shouldn't be bulging out in the neck. So it should be smooth like this or something like that. So if the jugular vein is protruding or distended, it might indicate a right-sided heart failure. Okay. So next is to measure the vertical distance in centimeter above the sternal angle by extending the long rectangular card horizontal at this point at the centimeter. So we're going to use a card and a ruler. Okay, there's the ruler. Now we're going to the card there and check centimeter. First, should be sure it is level. Okay, this level. Next is to check the carotid arteries. So palpate the carotid arteries and check if there is blood flow. The carotid arteries are right here. Yes, you can find blood flow. Yes, there is blood flow right there. Next is to use a stethoscope to listen for any swooshing sound of the carotid arteries. Hawa din exhale din pondo. Ano? Here swooshing. Next, we are going to inspect the chest. So we're going to take a general inspection of the chest wall, see if there are any abnormalities or something. Then we look for any involuntary movements of the chest. I can see there is none movement. Okay. Next, we're going to inspect and palpitate the pericardium. You should use the. We're going to put this in the. Going to use this to feel vibrations in the wall. None. Okay, next is press the ball of the hand firmly to the chest ball and feel any thrills or vibrations. So we're going to from here, going to feel the vibrations here. It's none. Here. Also none. Back to here. And back to here. There is no vibrations as I can feel my hands. Okay, the next is to palpate for impulses. We're going to palpate for impulses. So we're going to use the fingertips to feel impulses. So we're going to use our fingers to feel the impulses. So from here, there is none impulses. One here, here, and here. There is no impulses as I have examined. There are no impulses. Now next we are going to palpate the apical impulses, which can be found right here in the left lower part of the one, the chest here. But since there is nothing out of the ordinary there. Next is we're going to palpate the epigastric area in the upper abdomen midline. So, right, upper abdomen, there's the abdomen, and midline, here. Okay. No, there is none. Next is assess the heart and the rhythm of the patient. So, we're going to assess the heart. Next is to use the stethoscope. We're going to use the stethoscope to assess the apical of the heart. So, we're going to use the bell side of the stethoscope. Start. There. Next is the heart. The heart rhythm is fine. The heart rate is normal, not straining or anything. Next, we are going to assess the pulmonic area, which is in the left sternal border of the second ICS or intercostal space. So if it is the left sternal is the left sternal border in the second intercostal space. So first, second. You are looking for strange sounds, but since there are none. Next is the tricuspid area, which is in the lateral sternal border, fourth ICS. So if this is the second, this is the fourth. Third, fourth. Okay. Listen for strange sounds. There is none. Last is the apical area in the fifth mid-clavicular. So mid-clavicular, clavicle is here. It's the clavicle, sternum, clavicle, and the fifth. So here. Here. Okay, there is none. After doing that, if there are no strange sounds or abnormalities, you should repeat the process on the patient and with the patient lying on his side or facing the left lateral and also the sitting position. So next we're going to inspect the arms and legs. First, we're going to check the temperature and assess the skin if it is consistent. So I'm going to put my gun here and check the. We're going to use the dorsal side of my hand to feel as much temperature as needed. So on the other hand, for that the other side. Also check the underside. Okay, the temperature is normal, not too hot, not too cold. So the next is we're going to look for the venous patterns and lesions and edemas or inflations. So look for lesions, edemas. Okay, that's none. There are, I can see moles here, but that also bite marks, but those are not, those are normal. The moles are not protruding as much, so it is normal. Okay, the skin is normal, there are no lesions or edemas. Next is we're going to assess the nails if they are pinkish. You can see if the nails are a problem if they are not pinkish. If, for example, they are black. But also consider there are also skin cutics, or what they call it. Okay, we're going to check the skin, the nails, if there are any damages to the skin bed, nail bed. Okay. Next, check for the capillary refill. Okay. 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 Other side. Fine. Nice. Okay. Okay. Next, we're going to find the radial and ulnar pulses. So this is the radial pulse. Okay, I can feel the pulse in the ulnar. Okay, I can feel something. Next, we're going to assess if the pulses are okay. But before, pulse are. Yes, I can feel the pulse and it is strong. It is rated 2+, which is normal. So next is we're going to perform the Allen test, which is the simply testing the patency of the ulnar ranges and arteries. So we're going to make the patient close and open his hand. So please open and close. Okay, so open. Going to let go of the ulna. Okay, so blood came back, and again repeat. Close and open and close. Open. Going to release the ulnar, and the blood came back. So meaning his ulnar and radial pulses are intact or unscathed. So the next is we're going to test the lower extremities. First, we're going to assess the skin color and skin temperature. Just like the arms, wait, I'm going to just like the arms, the skin color is normal. Then we're going to test temperature. Okay. There are a lot of skin damages, but it's completely normal because of childhood or I don't know, working hard. Next is we're going to look for any alterations or edemas or any abnormalities. But so far, only abnormalities I can find are these scars, because this person might have been an energetic child or an energetic person, which causes these scarring around. But there are no lesions. I can't find any lesions or edemas or inflations. Okay, so the next is we're going to palpate the calves for any tension or firmness. So we're going to palpate the calves. There's no tension, does it hurt, sir? No. Okay. Cuffs. Does this hurt? Okay, tell me if something hurts. Okay. Next is we're going to palpate the pulse. We're going to palpate the popliteal pulse, which is under the knee. This is the knee. We're going to palpate the nerve, the pulse. There you are. Okay, there is pulse there. There is the pulse. There is pulse. Next is we're going to palpate the dorsalis pedis pulse, upper midline. The dorsalis pedis pulse is actually right up this. Okay, actually like here in this area. Palpate the pulse. Okay, so pulse is normal. You can find the pulse here. Okay, I found the pulse, and okay, it's fine. Next is we're going to take the posterior tibial near the heel beside the bulging bone. So the bulging bone near the heel, it is in here, posterior tibial. Okay, found the pulse. So the pulse is alright. Next, we're going to check the capillary refill of the toenails. These nails are fine. There are no damages, and the capillary refill is okay. Goes back to normal. Okay, so the capillary refill of the toes are okay. Next, we're going to do the Hohmann sign test or dorsiflexion sign test. So what we're going to do is push the feet with the dorsiflexion like here and here. Feel this side of your leg. There are distensions. Okay, there's none. Does that hurt, sir? No. Does that hurt? No. So that was just a brief overview of the cardiovascular assessment. So far, I did not find anything wrong with the patient. I didn't feel any abnormalities of the heart. I didn't hear any abnormalities of the heart. I didn't feel any lesions in the skin or any abnormalities apart from the scarring. It is okay, and the pulse was fine because was out, and the pulse were 2+, meaning it is fine. So since there is nothing wrong with the patient, I will dispatch him now, and we will see you in the next video.